Menopause marks a significant transition in a woman's life, typically occurring between the ages of 45 and 55, when the ovaries stop producing eggs and hormone levels, particularly estrogen and progesterone, decline sharply. This phase is often accompanied by a range of symptoms, including hot flashes, night sweats, mood swings, sleep disturbances, and notably, joint pain. Joint pain, or arthralgia, affects up to 50 to 60% of women during perimenopause and menopause, making it one of the most common yet under-discussed complaints. This discomfort can manifest as stiffness, soreness, or aching in areas like the knees, hips, hands, and back, impacting daily activities, mobility, and overall quality of life. While hormonal changes are the primary culprit, lifestyle factors such as hydration play a crucial role in managing and alleviating this pain. In this video, we delve deeply into the key benefits of hydration for joint pain during menopause, exploring the physiological mechanisms, scientific evidence, practical tips, and complementary strategies to provide a comprehensive guide. Understanding joint pain in menopause, the root causes. To appreciate the benefits of hydration, it's essential to first understand why joint pain becomes prevalent during menopause. The decline in estrogen levels is central to this issue. Estrogen acts as a natural protector of joints by reducing inflammation and maintaining the health of cartilage and synovial fluid, the viscous liquid that lubricates joints and reduces friction during movement. Joints contain estrogen receptors, and when estrogen drops, these receptors receive less stimulation, leading to increased sensitivity to pain and reduced joint resilience. One leading theory posits that lower estrogen reduces synovial fluid production, causing joints to dry out, similar to how it affects skin and vaginal tissues. This drying effect heightens friction between bones, exacerbating wear and tear. Additionally, menopause coincides with age-related changes that compound joint issues. Cartilage, the cushioning tissue in joints, naturally loses water content with age, decreasing from about 70 to 74% in youth to lower levels in older adults, which alters its viscoelastic properties, making it stiffer and less able to absorb shock. Studies on animal models, such as bovine cartilage, show that dehydration increases storage stiffness, resistance to deformation, but decreases lost stiffness, energy dissipation, potentially raising the risk of joint damage under load. In humans, this age-related dehydration is amplified by menopausal hormonal shifts, increasing the likelihood of osteoarthritis, a degenerative joint disease where cartilage breaks down. Other contributing factors include reduced physical activity, weight gain, which adds stress to joints, and inflammation from hormonal imbalances. Women on estrogen-blocking medications for cancer treatment, or those in early menopause, may experience accelerated arthritis progression. Lifestyle elements like poor diet, smoking, and inadequate hydration further intensify these problems, setting the stage for why staying hydrated is not just beneficial but essential. The fundamental role of hydration in joint health. Hydration is foundational to joint function because water constitutes a significant portion of the body's tissues, including those in joints. Cartilage is composed of 65 to 80% water, which provides its spongy, shock-absorbing quality. Synovial fluid, often called the joint's oil, is primarily water-based and serves to lubricate, nourish cartilage, and remove waste products. When the body is well hydrated, it efficiently produces and maintains this fluid, ensuring smooth joint movement and reducing friction that could lead to pain and inflammation. Dehydration, conversely, impairs synovial fluid production, causing it to become thicker and less effective, which increases joint stress and exacerbates existing discomfort. In the context of menopause, hydration becomes even more critical due to physiological changes. Postmenopausal women experience a drop in total body water from around 60% to 55%, largely because estrogen helps retain moisture in tissues. Hormonal fluctuations also disrupt fluid balance and electrolyte levels, like magnesium, potassium, and calcium, which are vital for delivering water to cells. A review on hormonal changes during menopause highlights that estrogen influences arginine vasopressin, AVP, a hormone regulating water retention, by lowering the osmotic threshold for its release and thirst sensation. This can lead to better water retention, but also increases the risk of hyponatremia, low sodium, if not managed, particularly in aging women where thirst sensitivity diminishes. Dehydration from hot flashes or night sweats, common menopausal symptoms, further depletes fluids, creating a vicious cycle that worsens joint pain. Key benefits of hydration for alleviating joint pain in menopause. The benefits of proper hydration for joint pain in menopause are multifaceted, addressing both direct joint mechanisms and indirect symptom relief. First and foremost, hydration supports the production of synovial fluid, which lubricates joints and mitigates the risk of osteoarthritis, a condition that becomes more prevalent postmenopause due to estrogen loss. By maintaining adequate water intake, women can cushion their joints, reducing the aching associated with unlubricated, stiff movements. Dehydration weakens cartilage by reducing its water content, leading to increased friction and pain. Conversely, hydration preserves cartilage integrity, allowing better shock absorption and flexibility. Another key benefit is the prevention of uric acid buildup in joints. Dehydration concentrates uric acid, a waste product, in the bloodstream, promoting crystal formation in joints that triggers inflammation and gout-like pain. This is particularly relevant in menopause, where low estrogen already heightens inflammation. Hydration helps flush out these toxins via urine, easing joint swelling and soreness. Scientific studies underscore this. For instance, research shows that mild dehydration can exacerbate low estrogen effects on joints by promoting inflammation and impairing kidney function in excreting uric acid. Animal studies on cartilage hydration reveal that partial dehydration stiffens joints but reduces their ability to dissipate energy, mirroring age and menopause-related changes that heighten injury risk. Hydration also indirectly benefits joint pain by moderating other menopausal symptoms that contribute to discomfort. For example, it regulates body temperature, reducing the intensity of hot flashes and subsequent sweat loss that leads to dehydration. Better hydration improves sleep quality by minimizing night sweats, which in turn reduces fatigue and the perception of pain. It enhances cognitive function, combating brain fog that might discourage physical activity essential for joint health. Moreover, hydrated muscles recover faster and support joints better, preventing compensatory strains that worsen pain. Overall, staying hydrated can reduce joint stiffness and pain frequency, with some sources noting up to a 50% decrease in related symptoms like night sweats when hydration is optimized. Recognizing dehydration and its impact on menopausal joints. Dehydration often sneaks up during menopause because the sense of thirst declines with age, leading women to consume less water than needed. Signs include dark yellow urine, dry mouth, fatigue, headaches, dizziness, confusion, dry skin, and specifically for joints, increased stiffness and aching. Even mild dehydration, 1 to 2% body water loss, can impair cognitive performance by 5 to 15% and shrink brain tissue, while for joints, it amplifies pain by reducing lubrication and promoting inflammation. In menopausal women, dehydration from frequent hot flashes can worsen uric acid accumulation, making joints sore and inflamed. Monitoring urine color, aim for pale yellow, and tracking symptoms can help identify and address this early. Practical tips for optimal hydration during menopause. Achieving the benefits of hydration requires intentional strategies. Experts recommend 1.5 to 2 liters, about 6 to 8 glasses, of water daily, adjusted upward for hot flashes. Add 250 milliliters per episode. Exercise 500 milliliters per hour. Or hot weather, extra 500 milliliters. An alternative calculation is half your body weight in ounces. For a 150-pound woman, that's 75 ounces. Incorporate water-rich foods like watermelon, 92% water, cucumbers, strawberries, zucchini, and spinach, which provide hydration plus nutrients for joint health. Flavor water with lemon, cucumber, or herbs to make it appealing, and consider electrolyte packets, low sugar, or coconut water to replenish minerals lost in sweat. Limit diuretics like alcohol, which worsens dehydration and hot flashes. Stick to 7 drinks/week max. Alternate with water. Caffeine can be moderately hydrating if under 5 cups daily, but monitor its effects. Use apps or marked bottles to track intake. Drink small sips throughout the day, and keep water bedside for night sweats. 4. Joint-specific relief. Combine hydration with gentle exercises like swimming, which provides low-impact movement while aiding hydration through immersion. Complementary approaches to enhance hydration's benefits. While hydration is pivotal, integrating it with other strategies maximizes relief. Regular low-impact exercise strengthens muscles around joints, improving stability. An anti-inflammatory diet rich in omega-3s, from fish, nuts, and antioxidants, berries, greens, complements hydration by reducing joint swelling. Hormone replacement therapy, HRT, may restore estrogen levels, indirectly supporting fluid retention and joint health, but consult a doctor. Supplements like glucosamine or turmeric can aid cartilage, but evidence varies. Weight management reduces joint load, and stress reduction techniques, like yoga, prevent cortisol spikes that dehydrate the body. Conclusion: embracing hydration as a menopause ally. In summary, hydration offers profound benefits for joint pain in menopause by maintaining synovial fluid, preserving cartilage, flushing toxins, and moderating related symptoms. With estrogen decline drying out joints and age-impairing thirst, proactive water intake is a simple, cost-effective way to reclaim comfort and mobility. Backed by scientific insights into fluid regulation and cartilage mechanics, incorporating these habits can transform the menopausal experience. Remember, every sip counts. Start today for healthier joints tomorrow.